Good morning, all of you. Today we have Dr. Nilita Ganju with us. A very warm welcome to you, ma'am. It is my pleasure to invite you as a speaker for today's webinar. Dr. Nilita Ganju is Assistant Professor in Pioneer Physiotherapy College. Ma'am has done Master of Physiotherapy in Neurological and Psychosomatic Disorder. She has worked in various rehab centers, in government camps. She has worked in stem cell project with various doctors. Today, she is going to share the knowledge about E Neuro rehabilitation, smartphone application. Again, a very warm welcome to you, ma'am.
Thank you, Jigisha, madam.
Yes.
I hope I am audible enough.
Yes, ma'am, you are audible.
Okay. So a very warm welcome to you all. First, I would like to thank Parul University for providing me with this opportunity. Now, we live in this technological driven world. As today itself, how all these webinars are possible because of the technology itself. Now, can we use this technology in our rehabilitation purposes? Yes, of course. There are so many technological advancements if we talk about neuro rehabilitation. But how can we use it in India at present in today's world? We will see about it. So let us talk about neurological conditions. If we talk about neurological conditions like stroke, you have Parkinson's disease, you have Alzheimer's, dementia, cerebral palsy, traumatic brain injury, traumatic spinal cord injury. Now, all these disorders, it has been found in the Lancet 2019 study that the prevalence of neurological diseases and the conditions have been doubled. Now there are more neurological patients, neurological diseases patient. And as we know, due to the chronicity and progressiveness of these conditions, the rehabilitation services, the treatment that is being taken by the patient throughout the lifetime poses an economic burden to the patient as well as to the patient's family, because they need to continue the rehabilitation services for longer period of time and or maybe in some conditions throughout the life. So it poses an economic burden, social burden, and it is very difficult for the patients also and for the family members and caregivers also to continue the rehabilitation services. For example, let's say we have a chronic stroke patient. Initially, stroke patient in the acute phase will perform all the exercises, will take part, and when that patient becomes chronic, let's say years passed, 3 years, 4 years, 5 years, 6 years, what happens? Patient loses interest, or the patient develops more severe disability or other disorders, or the patient loses interest in the rehabilitation. Patient loses interest in exercising. Simultaneously, when we also achieve a plateau phase, we also as a therapist don't see much of a recovery in these patients. Now, how can we motivate these kind of patients? How can we see that these kind of patients, they continue to do exercises throughout their life? There comes your technology. Technology can actually make and create an interactive environment, creative environment, and can again motivate the patient to perform exercises. Now, if we talk about neurological rehabilitation, we have various aspects in our rehabilitation. Like you have motor rehabilitation, you have balance training, strength training, cognitive rehabilitation, sensory re-education, sensory integration, and so many various other aspects. Now, technological advancement, if we talk from 2000 and till today, there have been so remarkable improvement in the use of technology in neuro rehabilitation services. So let us talk about the starting. It's like robotics. So robotics, what is basically robotics? All of you must have heard the use of robotic arm for improving the motor function, upper extremity function in stroke patient. So exoskeleton, you have neuroprosthesis, all these things comes under robotics. But is it feasible? Is it possible in India that each and every patient we can provide with this treatment method? No. Then comes your virtual reality. Now, this has been starting from 2000s and virtual reality platform in abroad countries, it has been going on. Now, what is virtual reality? Basically, an environment is created, like a realistic environment is created, simulations are created by a computer software, and in that software, the patient is taking part as one of the character and playing games. So these games will basically improve patient motor function. Sometimes it is used for improving postural stability. It is used for cognitive training. So there are multiple uses. But for virtual reality, what you need a monitor, you need a VR headset, you need that platform. There are so many technological equipments required. And India is yet to be faced, another problem with virtual reality in your rehabilitation services, that is lack of facility and acceptability of the patient. So is virtual reality possible in India? Again, in rehabilitation services, yes, in future, but still it is a long way. It is very costly. So again, the clinical use of this technology like virtual reality, robotics makes it difficult to use in clinical settings. Then we have XR games, video games. There are certain video games that are basically used for exercising. So same as sometimes even XR games use virtual reality platform. Nowadays, and during the COVID and after the COVID, tele-rehabilitation services have been on the ground. Earlier, we didn't knew. We were just studying about, okay, tele-rehabilitation services. But actually in COVID, we started with it. The physiotherapist went onto the online platform and started. But is it feasible? Is it acceptable? Especially in neurological conditions. So there are studies done in India regarding the feasibility of tele-neuro rehabilitation services. This study has been done in Karnataka, where a tertiary-based hospital center has developed a service to provide medical treatment or rehabilitation services to all the patients with neurological conditions. Particularly, they have included stroke patient, cerebral palsy patient, meningitis patient, GBS patient, DMD patient. For mainly, this service was used for consultation and advices and obtaining clinical data. Now, they have also said that these services, they are feasible in India, but there are many barriers that the patients are facing. The first barrier itself is lack of technology in small villages. City based, you will get all the facilities. But in small villages, again, there is lack of technology still in India. Next thing, again, there comes a problem of confidentiality, data protection, privacy, confidentiality. These are the barriers that are basically faced by the patient. So again, it is feasible, but still there are many barriers to cross. Now, let's talk about the acceptability of teleneuro rehabilitation. Now, another study that is done during the COVID-19 saying the implications for practice of teleneuro rehabilitation service in low and middle income countries. Now, in this country itself, they have found, in this, they have basically told that it becomes difficult for the family members and caregivers to understand the instruction. For example, let's say if you take any back pain case, neck pain case, shoulder pain case, and you are consulting online for that patient. So you can give advices to that patient. You can at least ask the patient to perform some exercises. You can see on the video that the exercises that patient is performing is better or not, or the patient is doing wrong. But what about neurological patient? If there is a stroke patient and you give instruction to the patient, now will your patient perform exactly the way you are saying? How will you correct? The patient is taking the hand into synergy pattern. How will you correct that? So it is very difficult, and sometimes in neurological cases, the caregivers or the family members also does not understand the instruction given by the therapist, and that has led to some untoward incidences also. So at present, still the feasibility and acceptability of the technological advancement in neuro rehabilitation services are in question. Now, in such cases where during COVID and after COVID, there is a piece of technology, if I would say, which is there in everybody's hand. From low socioeconomic status to higher upper class, all of the individuals carry a smartphone. Now it has become a necessity. If you say smartphone has become a necessity. Now even the elderly people, those who have never used any technology, are well versed with the smartphone functions, and they are also very much engrossed in the smartphone itself. So, in today's world, when everybody is using a smartphone, this piece of technology can help us, can do the same function like as other technological advancement, other technological equipments, and can help us in our neuro rehabilitation services. Now, if we talk about in 20s, early 20s, there was one concept of M health. Okay, particularly it started around 2013, 2014. M health, that is mobile health. So there are health-based smartphone applications. It is known as M health, mobile health. Now, what are these applications for? If we talk about, basically they are collecting information, collecting clinical data, assessing. Let me give you an example. Now, all of you had Aragyo Setu app. Each and every individual of India must have had, at least more than 70% of individuals have had Aragyo Setu app in their smartphone. Yeah, of course, it was mandated by the government, but still it was there. Now, this app, it was information based, it was providing information, it was health promotion based, and Arogya Setu app also collected clinical data for research purposes. So this was a simple app that is basically linked to health. Now, if we talk about health promotion and intervention, we have at present lot many apps available. Like if you see Healthify Me, it is again a health promotion app. It is again a very good informative app, intervention app. Certain apps you have like Fitbit app, all the smart apps and smart watches you have. Basically, they are used to detect, or you can say take outcome measures like blood pressure, heart rate. Of course, the validity is still in question, but still some of the sensors are very good, and they tell you the progress report. Then you have certain apps like medication reminder, planning apps. Then you have certain applications that provides you with the treatment facilities, which are the treatment available, which are the doctors nearby, like you have Medibuddy, Practo. So this is a generation, or the era that we live is M health. Okay, that is mobile health. Same way, we have physio based app also, physiotherapy based app also. Again, we have Indian based app also. So one of the example that I'm using, it is a free app, Rehab My Patient app. Again, in all these applications, you have to register yourself, and then you have various categories of exercises like shoulder, like as you can see over here, you have shoulder based exercise, elbow based exercise, wrist based. Then you have hand and fingers, lumbar spine, thoracic spine, knee, hip. Now, this app can be tailor made to some extent according to the diagnosis, but not much. It is not individually tailored. So, again, advices are there and exercises are there. So, we have such kind of apps. But again, the reliability and validity of the applications are still into question. But patients can use accordingly. Now, if we talk about smartphone applications for neuro rehabilitation purposes, so there are various categories in which the smartphone based applications can be used. Again, like providing health information regarding the disease condition, providing information to the patient, to the family member, and to the caregiver. Then diagnosing. Okay, this is the area. At present, we don't have any app, any smartphone based application that can actually diagnose any neurological condition. But still, University of California has developed an application that basically diagnoses neurological conditions like Alzheimer's, ADHD by looking at the pupil. So basically, they have incorporated the use of infrared camera that we have in our smartphones to assess the pupil. Now, this application is still under clinical trial. Then you have evaluation based app so that it can evaluate, or let's say outcome measures can be performed you in the form of questionnaire. Then you have certain applications like that gives already loaded up uploaded videos of the exercises that is need to be performed. So you have home exercise program, then you have exercise training, and you have exercise reminder app, calendar app, neuro diary app, like where there is an exercise reminder and the profile of the patient is kept. Then you have cognitive training. Now, this is one aspect where you have tremendous amount of improvement in the smartphone applications, cognitive training. As I told you, in the information based app, you have Nuria app. Recently, this app has been given permission to launch in India. Innopolixis have launched Nuria app in India. Now, this app is basically an information based app. Information means you have to start with the patient will enter his diagnosis, his data, like start by answering a questionnaire, like which disease you are suffering from, what is the level of disease. Then, after entering that questionnaire, individualized options are available in the application, saying the information about the disease, like what is this condition, what are the problems that this condition is having, then individualized treatment options, what are the available treatment options. In India, a lot many of the patient they are not knowing only that which are the treatment available. Like cerebral palsy kids, still the parents doesn't know. Okay, they go to doctor, they will refer, and then they know, but they don't know the entire rehabilitation services that they can afford, or they can be provided with. So this app basically will provide all the information based on the treatment options, including the medications and the rehabilitation services. Same way, it has got another features like there are many clinical trials going on throughout the world. And if a patient is interested, that patient can get registered in that clinical trial. And another feature of this app is chat with NeuroTwin. This is one of the feature that is same condition patients can chat together. They can form a group and they can share and they can get more information. Another information based app is your cerebral palsy app. This is Hyderabad based company app. It is basically in the form of a training module. Now, this application is basically who can use this application, like used by a professional healthcare professional also. Then it can be used by a caregiver, family member, educated of course, or the patient itself can also use this app. This training module consists of cerebral palsy. What is cerebral palsy? What are the disabilities found in cerebral palsy? What are the causes of cerebral palsy? Then which are the locomotor impairment found in cerebral palsy? And it has got various other diseases also, information about other diseases like poliomyelitis, rickets, spina bifida, muscular dystrophy, and it tells you how much module or how much progress you have done. Now again, this application has, it is a paid version, it is not available freely, it is a paid version. Now, next come, as I talked about cognitive training, cognitive rehabilitation. So this is one aspect where research is going on and so many aspects already it is done. And this is one area where we can actually use the smartphone application. Cognifit is one of the company that is basically working on the cognitive training part itself. So there is a Cognifit based software. There's a cognitive based personal coach software individualized for very patient's needs, according to patient diagnosis and patient needs. And you have a cognifit application. Cognifit application, again, it has got a free version and it has got a subscribed version. So in order to access this app fully, subscribed version is again little costly. It is 1,000 per month, or annually again it is around 5 to 6,000. But the free version that can be accessed. Now cognifit application has got two aspects. It is used for assessment of cognitive function and it is used for intervention or treatment purposes. Now assessment part, it has got battery of various neuropsychological tests. Now general cognitive assessment, you have a battery. In this general cognitive assessment, it can be taken up by plus 7 years old, and there are various functions of cognition like attention, memory, reasoning, planning. All these functions are assessed. It is a 30 to 40 minutes test. There are various tests based on questionnaire, based on games, and immediately the neurocognitive profile of the patient is generated, and it tells us which area, particularly memory or attention, which area is lacking in the patient. This is a general cognitive assessment. Same way you have other locked versions. When you will subscribe, then only you will be able to access it. We have over other cognitive assessment divided into memory assessment, perception assessment. Here perception, basically visuospatial assessment is there, that is assessed. Then you have reading comprehension assessment, reasoning assessment, and certain other higher executive functions. Now one more thing, this assessment is not diagnostic. This does not tell that the patient has a certain disease, but it will definitely tell that the patient has any cognitive decline or not. It will track the progress of the patient and in which aspect of cognition the patient has improved. Same way, it has got treatment interventions, or you can say simulation. These are games. Now there are a lot many games in our smartphone applications, like started with Candy Crush, Sudoku, and all other games are there that you can play. And you have a certain other sets of game like train your brain, mind games. There are so many games, memory games available. But here, as you can say, there is neuron madness, color bee. These are the names. Now, what are the aspect these games train? They are basically used to train attention, selective attention, or you can say focused attention, then visuospatial scanning, hand-eye coordination of the patient, response time, particularly processing speed of the patient, spatial perception, estimation, response time, or you can say reaction time of the patient, shifting from one task immediately to other task. That is basically shifting from one task to basically other task. That is your alternative attention. And then you have inhibition also. Here they are talking about cognitive inhibition. Cognitive inhibition means basically focusing only on one part, disbarring all the other stimulation in the surrounding environment. So that is, they are talking about cognitive inhibition. Same way, you have more than 50 games in this application. The free version allows us to access 20 games around. They are more than enough. So they are again trained, as I told you, planning, then processing speed, working memory. So all these things can be trained up. They give you a feedback. This application gives a time regular feedback to the patient, progress report of the patient, and also helps the patient to how to improve. Now, other feature of this cognifit application is basically mindfulness. Now, as we know, all these chronic cases, if you see, this chronic cases, stroke cases, Parkinson cases, these cases, they gradually land up into depression or anxiety and they lose interest. So that motivation, how to now make them calm. So you have mindfulness videos in the cognifit application itself. These, there are videos with the specialized music therapy. Then you have guided mindfulness session in which the patient can or the user can start the video, listen to the video and follow the commands, or else just listen to the video. Then you have other applications like Calm app, which is free and meditate, sleep, and relax. It has got various modes of meditation. It has videos, audios, and music therapy. Another app for your cognitive function improvement. As we talked about cognitive, same way you have another app that is your Lumosity. Now, Lumosity and Cognifit, this both of these apps have been evidence-based. Evidence-based means it has been found that when a patient or a user uses this app, cognitive improvement is bound to happen in a particular area. So it is like Lumosity, train your brain and activate your neuroplasticity in patients. So Lumosity has again another aspect where it is intervention, exercise based cognitive training, and it trains the various cognitive functions like mathematical skills. Then you have spatial perception, speed, memory, attention, and there are much simpler games compared to Cognifit. So this application is also paid. It is around 800 to 900 rupees monthly subscription, but the free version can be accessed and can be used for the patients. Same way, it provides you with the feedback. The training immediately gives you that feedback in which area the patient is lacking or the user is lacking. Progress has been tracked throughout the session, and also the patient can set goals himself or herself. Another app, all this application, if you see your mind games, brain training app, they are basically sitting app. You have to just sit and you have to provide, you have to basically use the games and train it. This is one app that is developed by Australian physiotherapists, that is Clock Yourself app. Now this is available at the rupees of 150. The application is available in Play Store. Clock Yourself app is basically train and walk, or you can say it is based on stepping. You can train your brain and simultaneously you can perform exercise. Now all of you know Frankel's exercise. All of you know that how we improve coordination. So there we draw footprints initially for the patient. Same way, this in this app, the exercise are based on a clock face. So a patient has to visualize a clock face. Like if you see the center one, that is simple clock. So the patient has to visualize a simple clock face on the floor and then start exercising. Like patient is in the center, standing in the center, and then the patient will be given a number. Like as you can see, it is a clock faced, so patient can visualize. And when the patient has been given a number, like there are audio prompts in applications, they are prompting an audio. The audio will speak one, so the patient has to keep the right foot on one number. Then if the audio prompt says 5, so the patient has to keep the right foot on 5 number. Same way left foot. So it is basically stepping. So you can improve balance in this application, then improve coordination, improve cognition. This application also has got another use, that is for athletes, for sports also. So this application can be used. Now here is the video on that site itself. Is basically, you can see how a patient is. Now this is an imaginary. Now here it is used to draw. This is an imaginary. In the same case, what the therapist can do, therapist can stand behind the patient, holding the pelvis of the patient initially, and can start the application. The application will just give voice commands: 1, 2, 3, right foot, same way left foot. Same way, the application will also tell you to do it fast. Slowly, the patient can, as the patient develop postural stability, improve balance, the therapist can lose the grip. Then the patient can hold somewhere. This app can be used at home also. Like stroke patient, Parkinson patient, they can stand where there is, they can take support from both the hands. Then you can start this application and use this application by training. So it is used, it is basically stepping along with. Now, how cognitive is trained in this app? Later on, instead of numbers, the numbers are replaced by various symbols, like the audio visual, or you can say audio prompt will tell as 2 plus 3. So immediately the patient has to see 2 plus 3 is 5. So on 5, the patient has to put the right foot. So in this way, cognitive training is also done. Again, processing speed of the patient will improve, reaction time will improve. So it is just like your star excursion test, or you can say it is just like your Frankel's exercise. It can be used at home by the patient, or even in our rehabilitation, we can use this application. Initially, we have to hold the patient, train the patient, and then the patient can use this application on his own. Okay. Now we have another application basically related to communication skills. You have AWAS application. AAC stands for Augmentative and Alternative Communication. This application is developed in India, and this application is basically for the children who are unable to speak. Now with children like cerebral palsy disorders, or you can say patients, stroke patients with aphasia, who are not able to speak, neurological conditions where speech is affected, they are not able to express their thoughts, emotions, needs. In those kind of patients, this application is useful. As you can see here, certain pictures are given, and according to the pictures you have written a word like yes, no, please, okay, can, want, stop, food, things, people, places. So if this application is used, let's say in iPad or in smartphone, the patient itself can touch. Like if a patient wants something or wants food, the patient can, or the child can touch on the food app, and this application will read the word written loudly. So this application is used. Again, it is also paid version is there at a 3,000 rupees of annual subscription. It can be used by patients with various neurological disorders. Now you have another app, facial paralysis application. Now let's say we always advise exercises to our Bell's palsy or facial palsy patient, that do this exercise in front of the mirror at home, do all these exercise. But usually what the patients do, initial 5-10 days, the patient will definitely perform exercise. What happens afterwards? He will perform once, he will not perform at all. Whenever the patient gets time, he will perform. So again, for this purpose, you have a facial paralysis app. This app is free and it is available, in which exercises are given. Video simulation is also given in this application. Like as you can see in the exercises, and there is eyebrow exercise, eyes exercise, mouth exercise, then blinking, winking. In eyes exercise, you can see there are so many other options in which the patient has to keep the smartphone in front of him or her, so that the video camera is on. It will simultaneously be able to detect how a patient is performing and will help the patient also to perform exercises. So regular exercises will be done by the patient. Now, in certain other applications, especially for facial paralysis, they have another feature in order to stop synkinesis. So, whenever the patient perform any exercise, let's say closing of the eyes, patient is performing closing of the eyes, the video camera in this application will detect how much the patient is able to perform. If the patient is performing properly, better, then it's fine. But if the patient is performing abnormal movement, then synkinesia is also detected and the feedback is given to the patient that please close your eyes properly. So there are certain applications based, again, applications like preventing synkinesis movement. There is a face rehab app. It is particularly for iPad and it is a paid version. So next, another application that we see is available, that is your Center of Disease Control has developed milestone tracker app in which milestones are tracked. So you have to create a picture, or you can say a profile of the child that is to be added. After a profile is added, the milestones are to be tracked, whether the baby is achieving that milestone within the normal range or not. So it can basically tell about the developmental delay. If a parent is using, it will tell whether the baby is growth as well as the milestone is according to the proper norms or not. So this is another application that is used, milestone tracker app. So if we see, we have information based app, we have exercises based app, we have, let's say, we have facial paralysis exercise based app, we have cognitive training and cognitive assessment app, then you have milestone tracker. These are some of the applications, smartphone application, that are used and that can be used, at least the free version can be used in patients rehabilitation. Now in a study where mobile phone applications, or you can say use of mobile phone application in Parkinson's disease, a systematic review. Now this systematic review have found total of 125 application, 125 application, and 56 out of that 56 are useful to some extent in Parkinson's disease, and rest of them 69, they are basically either assessment apps or they are treatment apps. Now there is one more problem, all these apps are not available on all the platform. Some of the apps are on Apple phone only, some of the apps are on basically Android version only, then some of the apps are working on Windows phone only. So there are many variations in this application. And one more thing, out of this 125 application, none of the application is available in India. We have similar kind of apps in Parkinson. So as you can see in this study itself, they have divided, like they have information based apps that is basically telling what is Parkinson's disease, what are the problems that a Parkinson patient is facing, what are the treatment available, or who is your nearest doctor or practitioner available, like that. Then you have certain assessment based app where certain or simple assessment, or you can say progress report, can be tracked, particularly related to medication, whether the patient is taking dopamine regularly or not. So assessment is based on medication most probably. And treatment based app, now there are very less treatment based app. If you see this PD warrior and this speech aid is, these applications, they are particularly designed applications for Parkinson patient. Like they have coordination improvement, dexterity improvement, speech therapy in it. And another feature that is there is music therapy, or you can say beats, visual, to provide visual cues to the patient. Like there is DopaFit app that is available. Then you have diary based apps that is available in Play Store in India for patients with Parkinson disease. So DopaFit app basically tells about that, or keeps the track of medications. How much dose was the patient on and how much the patient has increased with the dose, or the patient is on phase, off phase, patient is taking regular medication or not. Then you have other applications for Parkinson patient like Beat app, Beat medical app. This is a paid version. It is available, which basically give videos to exercise, then and basically visual cues, like it has got audio prompts. So whenever a patient is walking or whenever a patient stand, it gives an audio prompt and beats are there for music so that the patient is able to, particularly bradykinesia, that can be taken care of with this application. Then when another study where the use of various technological equipments advancement along with the smartphone application for cognitive training for people with mild cognitive impairment and dementia. In this systematic review also, they have told that all these technological softwares and all, they are helpful in improving the cognition in patients with mild cognitive impairment and dementia. But again, same thing as we see in technology, smartphone based app, there are many barriers. And particularly, they have talked about improvement is seen in software based, not mobile phone application, but software based. Like specialized software are there to train cognitive function, and it has got a personalized coach also, where the doctor of that patient can also get connected with it, can advise the patient how to do, and can track the report of the patient. Then you have, you, it can be cognitive or communication based application, can be used in traumatic brain injury. So again, mobile phone applications are useful in training the communication and cognition even in traumatic brain injury cases. It also helps in planning also. So you have certain applications where you can ask the patient to plan. So all this we have, applications are there, but is it useful in India? Only some of the application. Now, one more thing, the context validity of these applications are still unknown. So it is like that we have application, the therapist has to choose that your patient requires which kind of application will be helpful to the patient, that kind of application will help in exercises or can give that usage of application as a home exercise program. So if we see smartphone application, everybody is having a smartphone. So acceptability is there. Then for lower socioeconomic status, you can get a free version, and those who can afford can get a paid version. Then there is a certain education level required. Now we cannot give the smartphone application to each and every patient. Certain education level of the patient should be there. But nowadays, I would suggest that each and every individual knows how to operate mobile. So that can be there. But there is one more major concern, that is language. All this earlier application that I talked about, only one application, that is the Avaz app, is available in Hindi. Otherwise, all the applications, they are available in foreign countries languages, or they are available in English. They are not available in Hindi or local language. So again, that is a very big barrier in using smartphone application. Now how can this smartphone application help the patient? As I told you, the patient will get bored after certain years, so it will help to create an interactive and interesting environment, so patient will be motivated. Patient will be motivated to perform all these exercises. Then it will facilitate patient participation. Again, adding fun to your rehabilitation program. Remember one more thing, these smartphone application cannot be used alone for rehabilitation. It has to be used in adjunct with the neuro rehabilitation services. So at last, if I say there is a platform available, collaborate with the engineers or the software technicians and develop new apps. There is a lot more to develop in India. Develop new applications, use it in the patient. It will be very much beneficial for the patient. Now coming to outcome measures, we can develop applications related to outcome measures, like all the outcome measures and scales that can be used in the form of a questionnaire can be developed, and it will be easier for the therapist to collect data or track the patient also, as well as it will be easier for the patient to enter it. Same way we can develop an intervention based app. So I would suggest all of you to start up your own idea. Think about it, which application, which disorder you want to do. That application should have a language options also, and a simple app. Like, let me give you an example, like tap yourself app. Tapping, it will tell you the processing speed or the reaction time, how much you can tap. Okay, there are various application available. Tapping on the phone itself, so that will tell you the dexterity, that will tell you. So a new application can be developed. There are new applications available, they are developing, but again, they are under trial. The reliability, validity of these apps are not present or unknown. So you can develop new application. There is a platform, and let's see you can achieve in what, in neuro rehabilitation. Now, one of my patient, a Parkinson patient, was using smartphone application since 10 years. Now, this patient has been diagnosed with Parkinson's in 10 years, and I started the usage of this smartphone application with him since that 10 years. Initially, at that time, much applications were not available on the Android mobile, or you can say even on the iPhone. There were certain memory games, or there were just simple games, or there were, you can say, train your brain like mathematical skills or word formation. These games were only available, but is using till now. Is using till now. So I have just taken a small testimony of that patient. So let's see how that patient at present, the usage of this smartphone application helps. How long are you playing this smartphone applications? કેટલા વર્ષોથી તમે સ્માર્ટફોન એપ્લિકેશન્સ? 10 વર્ષ થાય. બરાબર. તમને કઈ રીતના લાગે છે કે આ એપ્લિકેશન્સ તમને મદદ કરે છે? સ્પીક લાઉડલી એન્ડ ક્લિયર. પછી મજા આવે છે, એટલે ઇન્ટરેસ્ટ આવે છે તમને. પછી કઈ રીતના તમને લાગે છે કે આટલી મદદ તમને એવું લાગે છે કે પહેલા કરતા ધ્યાન આપવું જોઈએ? લાગે કે તમારી પ્રોસેસિંગ સ્પીડ પહેલા જે તમે મોબાઈલ ફોન વાપરી શકતા હતા એ ગેમ્સ રમ્યા કરો એના માટે મોબાઈલ ફોન વાપરવામાં પ્રોબ્લેમ નથી આવતો લાગે છે? પછી કઈ રીતના મદદરૂપ લાગે છે? લાગે કેવું લાગે તો આ રમતા રમતા લાગે છે કે નથી લાગતું? એ નથી. તમે એક ગેમ કોઈ પણ રમીને બતાવી શકશો? કઈ ગેમ રમો છો? પહેલા કરતા કે તમારા સ્કોર વધ્યા છે? બીજી કઈ ગેમ રમો છો? બીજી કોઈ ગેમ જે તમે રમો છો? Okay. So we have seen how this patient was using the basic smartphone applications, or you can say even games. And these games also helped him. Earlier he said distraction. So distracting at home, he can use and get distracted from everything else. As you can see, he has got a lot of freezing episode, but still it does not get freeze while using the game itself. So smartphone application which are very easy to use, you can give as a home exercise program, or you can train the patient and you can make your rehabilitation interactive and creative. So with this I end. So at the end you have a huge platform or market available. So please develop new applications in India for our patients. Thank you. Okay, anybody has any questions?
Thank you so much, ma'am, for this session. Yes, ma'am. Am I audible to you?
You're audible, but the voice is breaking.
Okay. Yes, ma'am. Thank you so much for this information regarding these applications. Many of us are not aware about this e-rehabilitation, and if we use this application in our treatment, it will create so much of interest in the patient's great webinar, ma'am.
Yes, correct. So that is where we are now in technological advancement and we should do it. And in India, definitely it is required.
Yes, ma'am. Yes. Thank you so much. Yes, ma'am. You can leave the meeting.